What an extraordinary group of young healthcare professionals sharing experience about
which of those challenges people are feeling the most keenly. I bet burnout and fatigue are going to score. But the other issues are also very important. We're talking lack of formal research, lack of leadership and guidance from more experienced professionals, and not to mention, of course, equity and opportunities across the regions.
and the launch of the African Continental Strategy on Education for Health and Wellbeing has really raised the bar.
Yeah.
Now, great to hear so many high-level commitments in support of education and well-being. These are certainly in line with the priorities that young people have identified up as most important.
So moving forward, everyone, you can now choose between two sessions. So you have a choice, right? They're either about agents of change, stories front lines of the humanitarian response, and that session is very interesting. It's going to be covering how can we empower young people who are caught up in disasters and emergencies and ensuring that their rights are kept and building on their strengths. Then we have a second session, and that's called Ready to Learn and Thrive, promoting adolescent well-being in schools. Because as we all know, healthy students learn better, and good education is good for their health.
Both sound pretty interesting. I
Yeah.
mean, it's hard to make a choice, but the countdown on your screens is about to begin. And meanwhile, we have a powerful spoken word poem from Mumbi Macharia. Watch her on stage at this year's World Health Assembly. It was quite a moment. See you on the other side.
The right to health is a basic human right. The World Health Organization has 75 years of improving public health, but it's going to take each of us to walk the talk to reach the 30% who still are not able to access essential health services. Listen to the call and mean it when we join hands on the journey for health for all. So how many more movements is it going to take before you realize that fighting to have a voice should not be our own self-adventure? How many more poems, chants, before you move and give young people a chance to recognize that young people are creative, innovative, sustainable, with goals and ideas that with investments are attainable, but still you tell us to follow you and listen without questioning. But I think that says less about us and more about what you think of your own parenting. And frankly, we are tired of demanding your understanding. Our world has the most young people it has ever had. So I am calling to all my fellow young people from every part of every hemisphere, continue singing the songs that we sang last year and the year before that. We are not tired. Hatujachoka. We are inspired by the creative ways we continue to take up space. Grandmother's legacy and will is what I embody. Protest as a hobby. So to you, the 1.8 billion young people, keep making your voices heard. We will use to rejoice. Those voices are the same ones we will use to give others not only options, but choices. You are the moment. So with all your might, speak with the same conviction God spoke with when he said, "Let there be light." Thank you.
A vehement meet is here in Bahrain at the 146th IPU Assembly to share with the parliamentarians the 1.8 billion campaign for adolescent well-being.
I am supporting the 1.8.
Yo apoyo a los
Para mí es muy importante el futuro para los jóvenes.
We really need to drive the gender-responsive solutions to, tackle all the challenges that we face.
نحن ندعم مليار و800 شخص من أجل تعزيز صحة الشباب والنساء والمراهقين.
I support the 1.8 billion campaign because we need more young voices heard. Let's get more young voices heard.
Join the 1.8 billion campaign!
I support 1.8 billion people change.
My name is Youth Leader Dash and 8 billion Young People for Change campaign. I'm also encouraging the government to put keen attention to our education sectors.
Of the last count, moreover, putting the responsibility of the young people.
1.8 billion! We support 1.8 billion campaign!
Hello, we are here right in front of Palais de Nation for the 1.8. It started here right now. Join in.
We want to give the young people the opportunity to share about their choices, to share their plans, to share their needs about how they want their health and well-being to be improved.
Our role will be to get governments to commit to improving the lives of the 1.8 billion adolescents in the world today.
We are going to advocate for adolescents 1.8 billion campaign. Let's start now.
Hello everyone, I'm Sugandha, an adolescent girl leader from India. I'm 16 years old and a member of the congregation Our Lady of Charity of the Good Shepherd. My participation in the Adolescent Girl Town Hall was motivated of transport system in my community, which stems from our autonomy being ignored. It is imperative that all stakeholders, including member states, support our efforts to enhance adolescent well-being. A key area to assist us is by creating safe spaces where the victims of gender-based violence are protected. Thank you.
The reason we have the Youth Council is we believe that it can advise us what's important and what's necessary for our world. So the centrality of youth, I think no one can dispute. But from WHO side, we're benefiting from youth more. And on the 8 billion campaign, we're and make sure that the commitment. Thank you for your hand. Look forward to working with you even more closely through our youth council. Thank you.
$1.8 billion young people for change.
It's high time that we stop and reflect the voice of adolescents and young people. 1.8 billion young people for change campaign. We the young people of Nigeria support the 1.8 billion.
Welcome. My name is Diana Saritelis, and I am an obstetrician and gynecology specialist with Vivo Archipelago, Indonesia. I'm specializing in pediatric and adolescent gynecology and one of the co-chair of the Emerging Professionals Network of the International Association for Adolescent Health. The session today is brought to you by colleagues from UNESCO, UNICEF, WHO, the UNESCO Chair, Global Health and Education, and the International Association for Adolescent Health.
Hi, and my name is Roraima Costa Filho, and I'm a physical education teacher in Brazil with a postdoctoral research background in health promoting schools. It is our honor today to guide you through this session titled Ready to Learn and Thrive, Promoting Adolescent Well-Being and in Schools. Please feel free to introduce yourself to us in the chat. Tell us your name, which country you are from, which country you are joining us from today. We will also be glad to receive your questions and comments in the Q&A session or the chat box at any time. Some of the session today has been pre-recorded to keep the time on track, but we are also here live to take your questions and promote this discussion.
Roraima and I represent a partnership between early career health and education professionals working with and for adolescents, and that will be the spirit of our session today.
Yeah, we would like to draw your attention to the Read to Learn and Thrive report published earlier this year. You can find it in the resources sections. The session today is inspired by the report's vision that healthy, well-nourished, and happy adolescents learn better and are more likely to lead healthy and fulfilling lives.
And we recognize the human rights of access to education and information to young people in all their diversity, so no one is left behind. We also recognize the workload of teachers and consider how to support them in their role.
Indeed. In this opening video, adolescents from around the world will answer the question, what does the ideal school look like and do to maximize student well-being?
Ideal school is nurturing, inclusive space, fostering holistic development, and critical thinking while prioritizing student well-being.
An inclusive and safe environment. A safe environment where students may feel protected, may feel protected from bullying, violence, discrimination, where they can be free from each and every discrimination.
Training of efficient studying and planning skills in order to minimize stress.
Clean bathrooms, smoke-free zones, and healthy canteens in schools.
Sekolah yang ideal adalah sekolah yang memiliki lingkungan bersih dan saling toleransi.
And an ideal school for me is that school where students' voices and autonomy can be respected and the students can be included in decision makings of the school.
My ideal school should be a place where I am taught comprehensive sexuality education.
School with large ground, more trees and understanding teachers.
Sekolah harus berpusat pada siswa untuk bebas berekspresi dan berkreasi.
Peer mediation programs to teach lifelong skills of conflict resolution.
And an ideal school is that school that promotes supportive relationship between teachers, pupils, and parents, and between their fellow peers.
An ideal school should be inclusive for all children.
A safe, inclusive, nurturing environment fostering holistic growth and personalized learning. Nutrient-dense meals are offered at lunch, like this one. There is no shortcut for great education and a great school.
Thank you!
I really enjoyed the video. Listening to Ayodhya from Sri Lanka about Ross, large ground, more trees, and Demetrius from Indonesia who wants a place for activities, creativity, and expressions.
That's right. And Denise and Mukanta's thoughts on the importance of an inclusive and safe school environment resonated with me. These environments allow students to maximize their potential. So, you have heard what our global youth want. The question is, how are you going to get there?
No doubt, step by step. We are delighted to introduce our panel members to you who are going to lead the discussions today. First, Hannah Hogunbule is a public health PhD student from Nigeria exploring adolescent mental health. Second, we have Pierre Cook Jr., who is a law student from Barbados, a young leader in advocacy for the prevention and treatment of non-communicable diseases in children and young people. And the third, we have Suzanne Hargreaves, is a former senior education officer at Education Scotland in the UK, who specialized in health and well-being promotion in school.
Yeah, and we look forward to this conversation and to the audience questions. When we are designing the session, Pierre suggested a good way of breaking down this huge topic into two important themes. So we will look first at the school environment, the buildings, the spaces, the surrounding area, and how we can maximize well-being there. Then we will look at the learning process that go on schools, the relationships between people, the culture of schools, and the curriculum itself.
As we go into the first part, we would like to see your ideas about how the school environment can promote adolescent well-being. Maybe it's large green space for students to have activities. Please write them for us in the chat in English, Spanish, or French. You can do this while you watch our video case study from the Philippines on this topic.
Then here's some voices from the field about the issue reflecting the results of research carried out with teachers and health professionals during the pandemic by the UNESCO Chair, Global Health and Education. They will be presented by Miranda Beck, a young leader in public health from Finland.
Good day to everyone. I am John Michael Villa Sr. from the Water, Sanitation and Hygiene section of UNICEF Philippines. I have managed the Wash in Schools program since 2010 and the Menstrual Hygiene Management program since 2012. Thank you for allowing me to share the Philippines experience and success stories in investing in school environments and broader approaches to young people, parents, and communities. Since 2016, the Department of Education in the Philippines has implemented a comprehensive water, sanitation, and hygiene program in schools. WASH goes beyond hand washing, toothbrushing, and deworming to include food handling and preparation, menstrual hygiene management, health education, and capacity building. Menstrual hygiene management, or MHM, is an essential component of the Wash in Schools program in the Philippines. MHM promotes the right of girls to safe and dignified management of menstruation using hygienic materials, aided by clean and adequate water supply with safe and private spaces for personal hygiene concerns and sanitary pad disposals. To achieve this, the Department of Education enabled the implementing mechanism called the 3-star approach, where operational standards articulated incremental steps towards national standards. This involves schools conducting self-analysis to address gaps and areas of improvement. We also ensure that schools are motivated to move towards national standards by recognizing the efforts of school community to improve and achieve WINS objectives. MHM-related indicators, specifically water availability, gender-segregated toilets, availability of sanitary pads, and access to information, have been monitored since school year 2017 and 2018. MHM-related data within WINS monitoring presents impressive improvements that schools all over the country achieved within the last years. Today, more schools have included WASH into the regular planning and budgeting processes. The proportion of schools that have integrated WINS as part of the school improvement plan has grown to over 90%. In addition, sustainable funding for soap, feeding materials, funds for repairment, and maintenance has seen a substantial increase. In support of the Department of Education and with other partners, UNICEF continues to invest in providing positive enabling environment for our learners, including the promotion of gender equality. Together, let us promote gender awareness and empower children through education so they become productive and responsible global citizens. Thank you.
Hi, my name is Miranda Beck and I come from Finland. So what did the pandemic teach us about promoting well-being in the school environment? First, it is indeed important to keep schools open. Many respondents recognized that schools are a place that should always be open to adolescents for social, psychological, and economic reasons. Also, the physical school environment makes a difference. The success of implementing health protection measures during the pandemic was linked to the school environment. And for example, old buildings, lack of basic sanitation caused problems for teachers. Finally, those with chronic illnesses were especially affected. Participants noted that pandemics was challenging for students with diabetes, HIV, asthma, pneumonia, disability, mental health problems, as well as children from poor and vulnerable families. Participants elaborated that these students needed additional support from schools and parents for learning continuity. These findings show that we should keep school open as a priority, even when other institutions are closed. Update and invest in school premises to address gaps identified in the pandemic, such as access to toilets and clean water. Target health support in schools towards school staff and students who live with chronic illness, including catch-up visits to avoid dropout and long-term absenteeism. Thank you.
Many thanks to the Republic of the Philippines for presenting this case. And to Miranda, who is in the audience today. Do not hesitate to put comments and questions about this topic in the chat.
We would be very pleased to hear what the panel members thought of the first case study and the voices from the field. What do you think was important and useful for people trying to improve the school environment?
I would say prioritizing thinking of well-being holistically, so in terms of physical, mental, and social wellness, as opposed to just the absence of ill health. This way, we can ensure that every child, regardless of gender, economic class, disability, or health status, are able to see their schools as a safe space where they can come and be themselves without having to worry about being accepted, or if there's space for them, or even worse, if they'll be neglected due to their diverse needs. So making sure that the needs are being met, for example, by making sure that schools have active transport links so everyone can get to school on time and not have to walk long distances to school, or making toilets available and accessible, having having sanitary products available, water for hand washing, ease of getting from one class to another as well, not being afraid that they would be punished for needing to skip PE or sports for a day due to having cramps. I could go on and on with this, but basically making sure that every child's voice is heard and catered to, although I understand that this might be difficult if we think of diversity of schools globally and the difference in resources available as well. So analyzing where we are now in this movement and building processes to address these gaps is crucial for a safe, healthy school environment for children. Thank you.
Thank you. The Philippine Department of Education is to be commended for implementing a comprehensive water, sanitation and hygiene, or the WASH programme, in schools at scale. Menstruation hygiene management, the MHM programme, plays a significant part, and this tailored programme reflects one of the country's priorities and needs. The Ready to Learn and Thrive report recognises that tailored school health nutrition programmes are a practical and cost-effective way to improve equitable educational outcomes. These programmes can promote gender equality by increasing girls' access to and retention in education, which in turn can reduce the likelihood of early marriage and early pregnancy. Their 3-star approach is an example of looking inwards, using data gathered to decide what needs to be done. And incorporated into this approach are their national standards, an example of looking outwards to learn from the best and other practice to inform improvement actions. Monitoring and evaluation, which is a key component of any implementation plan, provides really powerful evidence to continue what they are doing. Indeed, since the 2016 implementation, more schools today have included WASH into their regular planning and budgeting processes. It shows that by focusing on one aspect of health and well-being, it can impact on other aspects of adolescent experiences. I'm sure many girls have benefited from these programmes being in place to take the pressure off and also the worries around their menstrual cycle and allowing them just simply to focus on learning when they're in school.
I think this conversation has been really useful for us to understand how we can protect the rights of young persons. And it's brilliant that we're having this conversation because it ensures that no one is left behind within the school system. Children should have unhindered and comprehensive access to education. We should ensure that their physical environment is safe as well as their social environment. Yesterday was Global Mental Health Day, and this conversation also ensures that those who have mental health challenges are also protected. So, really and truly, what we're discussing today is how we can comprehensively protect the rights of all children to free and safe access to education. This is bigger than just a discussion about what happens within the schools, but it's about ensuring that we protect our young people and protect our future.
So thank you, Pierre. Thank you, Pierre, for your response. So now we're going to start our Q&A session. And thank you for those of you who are asking questions in the Q&A box. So I think I will start with the first question for Suzanne. Suzanne, what do you think one of the adolescent well-being domains is about safety? And how can students and teachers feel safe in school?
I think the important thing is, first of all, to do a survey to ask the children, young people, what being safe means for them. Young people are the experts of themselves. They're the experts of the school that they are in, and so are very well placed to have an opinion, to have knowledge about what it means to be safe in their community and in their school. So a pupil survey would be my first point. I would also do a teacher survey because, again, the important thing is to find out where they're at. And once you have that data, you can then think about a plan and include, set up a committee and have a plan around building a safe environment. And I think that starts with the relationships across a whole school community.
So do you think who's going to start doing the survey?
Yes, I think young people are very articulate. We heard that in the videos, and they are best placed. Find people who are like-minded. Find people who feel the same as you, and try to include a range of people across the school, different age, different cohort, different gender, race, and try and bring people together to really have good discussions so they're building a foundation around what they want to do, and then have a timeline around that. You know, it's not a talking shop, let's get action. And then try to bring in some leaders, because after all, they might be the decision makers, but actually we want young people to be part of that decision making process. So engage as many people who are perceived to have the power in the community and in the school, and bring them in with the young people to set up a plan.
So this can be an idea for the student council to start with, asking,
yes, I think
doing some survey. Yeah.
Yes, I think student council, but you can then look across the municipality and see if there are student councils there, because it's good to look outwards to see what other people are doing. And then, of course, in some countries, they have youth parliaments. So, try to find out how they manage that in that country. Would that be something that would be worthwhile to do in their own country? So it's about kind of looking inwards at their own context, but also looking outwards to learn from others.
Pierre, do you have any comments on that?
I do. I think it's brilliant that we're having this conversation. And I also think that in discussing the protection of the right to education, we have to look at the built environment, both within and outside of the schools. So it means in doing those surveys to understand from young persons what is needed within their school system, we talk about and we ask questions about what is being offered within and outside the school. I think children should have access to an education that is free and unhindered and in their best interest. So it means that within their physical environment, they're not exposed to predatory marketing, they're not exposed to harmful practices, they have access to clean drinking water, they have access to healthy foods. Because as much as the physical environment is important for the development of children, what they're consuming and what they're engaging in within that school system is also important. So I think in looking at those surveys and pointing out leaders, it is important for us to speak with young people, but also policymakers to make the right decisions.
Hannah, do you have any idea how can we create a good environment in both home and school?
I think including parents as well. So the school, young people come in there and they spend a big part of their life in the school environment, but also at home as well. So the school working with parents to ensure that young people are safe, young people are being catered to both in their home environment and the school as well. Also, speaking to young people about what their needs are, because young people's needs are diverse. Some suffer with chronic health conditions, disability, mental health struggles as well. And most times, young people aren't prioritized in these areas. So making sure that the parents, the school, the teachers as well, because they also have a big part to play in all of this. So the teachers need to be carried along. They need the messages needs to be the same across all boards as well. Speaking to teachers, hearing their voice as well, and seeing where they struggle and what sort of trainings they might need and what sort of support they might need as well to be able to make sure that young people feel safe in schools. Young people's mental health matters. Young people, regardless of disability and social economic class, are all considered as one, are all given an avenue to thrive in schools, basically. Thank you.
Thank you, Hannah. And thank you all for your broad experience. And probably for the last, I would ask Suzanne, what could we do regarding access to health service through school?
I think it's important.
Now we turn to our second part, the process of learning.
Go on.
Sorry, I think the important thing is to have a whole school community approach. So there's a shared understanding of what we mean by education, health in education, and what we're trying to do. So this involves teachers, but also non-teaching staff, because children have strong contact with them too. Parents, as Hannah said, but also community partners, the health community partners that locally support families in the community. If a school and the young people can share their vision and their ambition about what they want to achieve with the health partners and bring them on board when the early discussions are going ahead, then you have a shared understanding, and it means then that there is a key understanding between school, community and home.
So the key messages is school needs to stay open in time of crisis. Lack of investment in school buildings and facilities needs to be reversed. Think about environment around as well as within the schools. Mixed messages will not work. Unhealthy products in schools undermine the healthy curriculums. and students with chronic illness and disability need seamless access to health services to stay well and to be in school. So thank you all to our panelists for a great discussion. Now we turn to our second part, the process of learning. This is, of course, about how students learn, but also about the relationship between important stakeholders. Examples could be teachers and parents, or teachers and health professionals.
That's right. It is also about the culture in school, the support for teachers, including their initial training. Remember that our global youth talked about tolerance and understanding teachers as part of the ideal school.
Yeah, and also Jessica from Trinidad and Tobago said about there is no shortcut to great education and a great school.
While you watch our second case study from Ireland and voices from the field on this topic, please respond to the poll in the chat. What is the most important thing to improve for a better learning process for adolescents' well-being?
Good afternoon to everyone. Our school has 770 students. They are all girls, and we accommodate students from the ages of 12 to 19 years of age. Our well-being program is centered around what we call 4 pillars of the curriculum. Now, I've divided this up subsequently into a simplified approach, looking at the heart, the hands and the head. The head area is all about the planning and the preparation. Now, our Department of Education in Ireland has been very progressive in planning all the areas of well-being, and they then distribute them to the schools after a collaborative approach, and we start the implementation. That's so much in the upper column there under the heading of curriculum. And that's where the teaching and learning takes place. That's where the practical hard work, which I refer to the hands, takes place. But what I really want to focus on today is the heart of the issue. What is needed to ensure that we have well-being in every classroom, that every child, every student understands what well-being is and experiences well-being. And what do we have to do as leaders to ensure that every teacher implements well-being at a whole school level? When the inspectors looked at how our students felt about the school, the 2 words that the students mentioned about our school was that they felt safe and they felt cared for. And that to me is the essence of well-being. One of our main learning is that you need to keep your team of teachers to a core group, and that core group needs to be absolutely committed to the whole area of well-being. Well-being is an area that not all teachers are comfortable with, so in order for it to be a success, you have to have buy-in from teachers. Before we can look after the well-being of students, we must look after the well-being of teachers. We must ensure that we build processes in the school so that everyone feels valued, that our students feel that they have a voice. We've changed the language in terms of how we speak about things. Many years ago, we talked about discipline. Now we talk about positive behaviour. Well-being in Ireland is no longer what it used to be, which was a filler-in subject. It is actually now part of who we are.
What did the pandemic teach us about promoting well-being through the processes of learning? First, health education is crucial. Most education professionals and a few health professionals shared that providing health education in schools was an important infection control measure. Teachers provided awareness and information to students, including demonstration of hand washing and discussing the current situation with the students in a manner they understand. Education professionals noted that schools were a safe space for children that encouraged interaction and prevented loneliness, depression, and anxiety. Finally, teacher well-being matters as well. Some believe that the adaptability among teachers and schools teams in creating remote learning methods during school closures had not been widely recognized or praised. Incentivize local education and help professionals to work together in non-crisis times to form strong connections that can support schools and communities through future health crises. Monitor student and staff well-being and include parents in these initiatives. Thank you.
Many thanks to Dr. Olive Lafoy for presenting this case, and again to Miranda. Do not hesitate to put comments and questions about this topic in the chat.
Yes, please do write in the chat. And of course, we would be very pleased to hear what the panel members thought about the second case and voices from the field. What points about curriculum and culture resonated with you?
I love the approach of not leaving anyone behind and every child feeling safe and cared for in schools. So well-being, not just in terms of a buzzword, but something that everyone in schools understand and experience. The change in language from discipline to positive behavior as well, shifting the focus from punishment and reward to behavior that impacts everyone. That way, children are nurtured to be better and don't have to feel like they need to earn care. They are respected and viewed as important. So respect for their autonomy, choices, and behavior would be highlighted, as their peculiarities don't make them miss out on being looked after and speaks volumes to the child as well. As shared within the Ready to Thrive in Schools report, well-being is an essential component of maximizing educational potential and a key determinant even of educational outcomes. Hence, it should be a very important component of planning the top curriculum in schools, be it maths, science, or English, and teachers should be trained in highlighting well-being as the primary objective of teaching. Thank you.
Thank you, Dr. Lafoy, for sharing your case study. The college accommodates girls from age 12 to 19, and that shows that a school is best placed to consider sustained implementation or the longitudinal well-being of students in their care. What does the school look like and feel like now? And what will it look and feel like to each age and stage as the students progress through the college? It gives each school the opportunity to develop key life skills, knowledge and understanding in health and well-being over a long period of time. And as the Ready to Learn and Thrive report states, healthy, well-nourished children and adolescents learn better and are more likely to lead healthy and fulfilling lives. And I think the Dominican College recognises this. Dr. Lafoy provided the wellbeing programme centred around the 4 pillars of the curriculum. Here, they have set their ambition and designed their programme. Education that develops life skills, positive values and competencies can improve emotional well-being and reduce risk behaviours. And this is a critical element of quality education. Dr. Lafoy also acknowledges that some teachers may not be comfortable with health and well-being if they're a particular subject area, and talks about what we have to do as leaders to ensure that every teacher implements well-being at whole school level. And what this demonstrates is that the leaders in the school community show that health and well-being is important. If commitment is made at leadership level, things will happen. And of course, central to that is professional development at all levels is critical for a sustained school, whole school approach.
I think what we are learning from this discussion, and some parallels I'm seeing to what we're doing in Barbados in terms of reforming our educational sector, is if our social settings, if our teachers, if our policymakers, if our community organizers are committed to ensuring that within the schools, the most vulnerable are protected, then we can ensure that we have a safe learning environment for everyone. We listened and we heard conversations about quality education, ensuring that teachers feel safe, ensuring that children feel safe, ensuring that we have a comprehensive educational system. But it also speaks to making sure that we protect those who are most vulnerable, those children with mental health disorders, those children who don't have access to healthy foods at home, those children who may be coming from difficult home settings. It's to ensure that when they enter the gates of their school, they feel safe and protected and as if their right to education is being looked after. That is the important conversation, and that is what I want us to take away today.
We spend around 15,000 hours inside the school gates completing our primary and secondary education. Schools are our second homes. They are where we grow up, learn, make friends, hope for the future, and try to fulfill our potential. Governments and schools should have policies and resources focusing on ensuring all students fulfill their right to quality education, health, and well-being. This means schools must be founded on principles of democracy, equity, and promote values and practices which prioritize health and well-being. School leaders should involve their students in decision-making. And teachers, parents, and community leaders should work together to promote the health and well-being of all students. Teachers should teach students life skills to help them make healthy choices, not only care about their grades. Schools must foster an atmosphere of friendship, understanding, tolerance, and empathy, where nobody gets ridiculed, excluded, threatened, or hurt because of differences in gender, ethnicity, family status, or exam scores. School environments must be safe and healthy, free from tobacco products, drugs, alcohol, and unhealthy food. They should have facilities for physical exercise, play, water, and sanitation. Students should have access to quality health services, including regular health checkups, psychological support, and mental health services. In summary, all schools should be health-promoting schools. When students are healthy, they learn better and have brighter futures. This vision is set out in the Global Standards on Health-Promoting Schools, which call for a change from scattered, isolated interventions to a whole school and whole education system approach to promoting health and well-being. From principals and teachers to parents or government officials, we must all do more to ensure every school becomes a health-promoting school.
Yeah, thank you all for your thoughts on these topics and for the video. So now it's turn to make our attention to your responses from the poll. We receive a lot of questions and a lot of answers as well, and opinions. The most strong messages related to the need to build relationships and culture, and they need to be improved. So I will organize some questions from the pool here for our panelists as well. I'd love to hear for everyone now, for Hannah, from Susanna, and from Pierre, to hear about any examples of how to successfully improve learners' connections to school, making young people wake up each day, each morning happy that they will be going to school and they are going to make more, receive support for their lessons they may have failed earlier, or how they could supplement this barrier. What do you have to say about this? How can we make improve student learners connections to school? Maybe we can
If I
start with
may begin.
Suzanne. Oh, Pierre. Oh,
Sorry.
sorry.
Yeah, I
I'm
was
having
saying
some lag here.
if I may begin, I think it's important that everyone is committed to protecting the best interests of the child. When I was at school, which wasn't so long ago, I felt comfortable going when I knew that everyone's looking out for my best interests. So I knew that when I got there, the physical environment would be comforting. There were enough green spaces, there were spaces for me to engage in physical activity. I felt comfortable when I had access to mental health services. I had a really close relationship with my guidance counselor at school, and I always felt supported. I also had teachers who I felt were interested in ensuring that I left with the best education. And I also wanted to make sure that when I was at school, I had access to healthy foods. So you see, this conversation is about making sure that everyone, both within and outside the schools, so we're talking about vendors, parents, and community leaders, are committed to looking out for the best interests of our children and ensuring they have access to comprehensive and quality education. I think when we start looking at that best interest approach, we can create better learning environments.
So, Suzanne?
Yes, I would completely agree with Pierre. I think putting the child at the centre of all policies, of all decision making that goes in the school community is absolutely central. And I think it's important, as I said in an earlier part, about a whole school approach, because the relationship between education and health is symbiotic. In other words, it's interdependent. And where this works really well is when everyone, and I mean everyone in a whole school community environment, understands that education and health has to mean putting the child at the centre. But of course, how do you make that happen when you might have teachers or you might have students or parents who are not interested in health being part of education? They might say, well, what's in it for me? You have to be brave to go to school sometimes, and school is welcoming and has the child at the centre and has key people in place for every child. So that could be peer mentors, it could be guidance staff, key staff links to home, where they're putting the child at the centre to make sure they're supported, so that the child feels that when they enter the school gates, they feel safe and supported and nurtured. And for those who are maybe reluctant to engage in this agenda, and I don't think that's anyone that's here in this forum, but you might know of people when you go back to your own context, how do you convince people? I think you need compelling evidence to change the hearts and minds of those of whatever level they're at who are reluctant. And there's huge amount of evidence, particularly from the people in this forum, from UNESCO, from UNICEF, from WHO, UNESCO chair, the global chair in health and education, have really strong, compelling evidence. So when you feel as a student or as a teacher or as a partner, community partner, that you're not getting anywhere, why don't you access the huge amount of evidence and research that tells us that this is a good thing to do? And it would be great if people who are in this forum today could share links in the chat box with compelling evidence that can help people who are dealing with those who are more in this agenda.
Thanks. And Hannah?
Like Pierre and Suzanne has said, I think keep making sure that the young people's voice is at the center. So their autonomy, making sure that they're heard. Also removing the focus of schools as just being a place for getting an education to a place where young people can grow holistically. So socially, mentally, emotionally, intellectually as well. Shifting the focus of schools and education from just grades to the overall well-being of the young people as well. So young people can feel safe, excited to come to school, knowing they will see their friends, knowing their teachers will not just um, be focusing on teaching them, but also grooming and growing them as well. sorry, making sure that young people know that a school is a safe space, somewhere that the focus is not just on their grades. So, like the Ready to Thrive in Schools report said, maximizing educational potential and a key determinant to even educational outcomes is well-being. So making sure that young people know that coming to school, they're not just coming to learn maths and English and physical subjects. They're also coming to learn how to feel better, how to relax, how to have a good understanding of their emotions as well. And yeah, that their well-being is at the center of the curriculum, not just coming to school to learn, but also coming to school to grow holistically. Thank you.
Thank you all for your thoughts on this and your opinion. As a resume from the key messages we received from the pool, we can highlight that the student need to be the center of on the process of the development. Also, well-being should be woven through the curriculum, not something a spotlight on some discipline, but need to be all around, need to be the core of the education. And the school leadership and culture, we need to be committed to the role models is vital. And finally, teachers need to support and confidence in this role right from their initial training. And moving on from this poll and going to our final part of the session, I would to ask you briefly, all you, what would be an action that young people could do after the section?
I think I want to jump in quickly to
Yes.
say that young persons can lead the conversation, young persons can lead the action. But I think young people also need the support of their governments, and young people need support of their schools. So even as we ask young persons to step forward and to be equal partners in the fight for comprehensive and quality education, we also need to call to action those teachers, those principals, those ministries of education to support young persons so that it's not just a one-sided conversation or fight. We have the passion and we know what would be right to protect our interests, but we don't have the power necessarily to do that. And so we need the commitment of governments, teachers, principals, schools, and the community environments to protect our children. And a final point I want to say is, as much as we look at the best interests of the child, we must also ensure that teachers feel safe and protected within their school environments so that they feel happy coming to school and so that they feel happy to support the learning of our children.
But you, Hannah, what do you think we should do?
Thanks, Diana. I think letting young people know that they have a voice, that we want to hear from them, um, their their voice matters as well. Also creating avenues that they can share. Young leaders groups, advocacy groups as well from the schools, giving them access to the policymakers, the school administrators as well. Just making sure that young people know that their voice is heard. They can share how they share their concerns and to be basically working together with young people, showing them that they are partners as well in their education, in learning, in the school environment, and they're not just sent to school as a punishment, but it is something that they can build how their schools will be. They can be a part of building how their schools would function as well. And I think that would make young people incentivize and even feel confident to come to school because it is a place that they have built together with the adults as well. Thank you.
So thank you. I would like to say thank you, many thanks to our panel contributors to the video, all the session partners. We hope that you will go away energized and committed to ongoing work to increase adolescent well-being in schools. Whatever your role, whether you're a student, a parent, a teacher, a health professional, a policymaker, or a funder, you all have a part to play. And if I may share a brief message that resonated with me during my studies, it would be think globally and act locally. Please look at the resources for the session. Thank you for your attention and your excellent comments and questions. Enjoy the rest of the forum.